Good morning and welcome to today's workshop on systems thinking in public health. Opioid dependence can be considered a complex health problem. There are many reasons a person can become dependent. This can be what is commonly referred to as accidental addiction to prescription painkillers following an injury. I would argue that there is no such person as an intentional addict, though there is a distinction in health systems that defines risk-taking behaviour such as injecting drugs is not accidental. There are many reasons for drug misuse. This could be childhood trauma, a psychological drive to numb emotional pain, or a physical dependency with restricted access to prescription medication. For those of us working within the pharmacotherapy area-based network, we understand no patient journey is the same. We need to be respectful of people who inject drugs as much as the skilled worker who finds himself chained to the dragon, so to speak. We've all felt the pressure of having to find new willing prescribers when a doctor retires or has their prescribing restricted. This scramble is a frustration for all of us, and I'm here to conduct an induction workshop on how systems thinking has successfully been used to take a more proactive approach to the problem. By using methods and tools, we can explore connections, influences, multiple stakeholders, and much more to collaborate to address health inequities experienced by people seeking opioid replacement therapy to strengthen the health system. Systems thinking has been historically used to solve complex health problems. Two examples provided here. The first, Hope for Health, is a program that was first piloted in Elcho Island in Northeast Island Land. The project involves multiple stakeholders including government, charitable organisations, medical and allied health, but most importantly the local Aboriginal and Torres Strait Islander community. Prior to colonisation, and even as recently as the 1970s, the First Nations population enjoyed particularly good health. The advent of Western processed foods, tobacco and alcohol saw a significant decline in health. By using systems thinking strategy, a strategy was developed wherein the residents attend a 2-week retreat. This is peer-led and focuses on making healthy choices. The results have been spectacular, with 80% of participants reporting a healthy blood pressure within 3 months of the retreat. Smoking cessation has also been notable. Another systems thinking success was Turn to Health, which many of you are familiar with. For the first time, the Victorian PABNs partnered with the pharmaceutical industry, the RACGP and the Pharmacy Guild to map out accredited prescribers and dosing points for opioid replacement therapy. This partnership was unique to Victoria. Although Turn to Health was a national website, there remained a reluctance in other states to partner with industry. As a result, we identified that we had geographical gaps, and Gippsland is of concern, which is why we're here today. Engaging stakeholders is critical to adopting a systems thinking approach. We have here our friend Dr. Fergal Armstrong, who's gone from being a country town GP to one of the biggest advocates of treating your own patients for opioid dependence, and the accredited trainer for ORT. We have Victoria's largest Aboriginal community here in Gippsland at Lake Tyers, and there are no local prescribers despite a high prevalence of opioid dependence. Many choose to travel to the culturally sensitive Access Medical Clinic in St Kilda, although thankfully we have a local trained nurse practitioner at Lake Tyers who can supervise dosing. We're all aware of the challenges faced engaging new prescribers and dispensing pharmacists who don't want those patients hanging around. Addiction doesn't discriminate, but unfortunately the health system does. Let's see if we can use systems thinking to address this more effectively. Systems thinking adopts a variety of methods and tools to address complex health problems. I've listed them here. The first is agent-based modelling, or ABM, which sees each stakeholder as an actor playing a role. This is probably the most appropriate model for this group, as we play particularly important roles, though not starring, as we are neither the patient nor the prescriber. Important on the list, as we are the glue that binds this group together. Other models listed include social network analysis, and for those of you involved with the treatment of hepatitis C post-2016, when the new cures became available, would relate to this. Remember, the goal was to encourage drug users to enter treatment together, particularly with limited access to needle exchange programs in our more remote areas. Moving across to tools, the workshop will be focusing on participatory Impact Pathways Analysis, or PIPA. This involves several steps, and we will practice with the first two today. Web links to each of the methods and tools are provided in your workbooks. If you would like to explore these further, I would encourage you to do this, as you may have a light moment, and that could bring some innovation to our group. Now on to our first activity. I need you to divide into 3 groups of 6. The tables you're on will do this nicely already, and using the sticky notes and flip charts, collaborate to develop a problem tree that outlines the social, environmental and economic factors that are contributing to the challenges of accessing ORT in the Gippsland area. An example of a tree is provided in your workbooks. I need you to finish on the problem that you wish to act on, determine it. Now take 30 minutes to work on this, and then each group will present to the wider team for 5 to 10 minutes. I want to iterate that this is not War and Peace. This is an opportunity for each of us to bring our real-world experience to the table. We all come with our own insights and perhaps unconscious biases. This is a chance to map out the nuts and bolts of the problem so that we can move on to the next step with a true understanding of the key factors of the problem and move to the next phase towards a solution. It's a chance to think outside the box and not simply continue the way it has always been done. I'll let you know when we have 5 minutes remaining. Have fun! Thank you all for your energy and enthusiasm. I can see some of you are getting ahead of yourself and starting to come up with solutions. These are fantastic, though for this exercise we need to stay focused. I hear loud and clear the core of the problem is the lack of accredited prescribers, and there are lots of reasons for this. The next exercise in our systems thinking workshop is to derive project outputs. So, using the term from activity 1, being the lack of prescribers, I need you to derive the project outputs. I'll just move on to the next slide, sorry. To derive the project outputs that will best address the problems, or the best case scenario to address challenge accessing OIT in their Gippsland area. Work in the same group to come up with your list for 15 minutes, then report back to the wider group for 5 minutes. Iterate, this is not the solution, though I know you'll be tempted. I will let you know when there are 5 minutes remaining. Thanks again for your energy and participation. There are a lot of ideas flowing, a few new ones popped up, and I really like John's team, who suggested that attracting overseas trained doctors, particularly doctors like our friend Fergal from the UK, to the Gippsland region will be successful project output. We know due to the way the NHS operates that the UK trained doctors are more likely to treat opioid dependence and see it as part of general practice. There are no guarantees that such recruits to our region will undergo accreditation, but we have an output that we can work with. It will lead to the innovative strategy of engaging with the distribution priority area to make it happen. Again, getting ahead by coming up with a strategy at this stage, I really credit the enthusiasm. I'm confident you can now see how systems thinking can be used to reduce health inequality and strengthen the health system with innovation. Thank you.